Hello, good morning.
Good morning.
How are you?
I'm good.
I'm Tulsi Kharal Bhatrai, BSc and third year nursing student of York University. Could you please tell me your name?
My name is Ram Prasad Bhatrai.
Okay, how can I address you?
You can call me Ram.
Okay, Mr. Ram, today I'm going to examine your chest, heart and abdomen, and for this I need to expose these parts, and it involves the gentle touching, and it will take maximum 30 minutes, and I will take the video. All the information collection during the examination will remain the confidential. Only the things I need to submit the video for to my professor for my grading purpose. Okay, is that okay for you?
Yeah, okay.
Okay, and before starting the procedure, would you like to go washroom?
I already went.
Okay, Mr. Ram, that's great. And now I'm going to wash my hand. And we have the privacy here. I just close the door, window and curtain. And you need the extra seat?
No, I'm comfortable.
Okay, that's great.
Yeah.
Okay, and Mr. Ram, I see you are sitting on a straight position, and you seem relaxed, calm and comfortable and free of pain, and you are well groomed and dressed according to the weather, appropriate for the weather, and I don't see any discomfort. Your respiration, you are not using any accessory muscle, and I can see you understand what I am saying. Yes?
Yeah.
Okay. And I'm going to start the assessment process from your anterior chest, so that I would like to request you to expose these parts. Okay?
Okay.
Okay. Thank you, Mr. Ram. Okay, give me this one, and I'm going to put this draft here. I would like to request you to talk here. Okay?
Okay.
Okay, thank you. And I'm going to start from the anterior chest, and I follow the technique of inspection, palpation, percussion and auscultation. First, I'm going to inspect the anterior chest for the safe configuration and use of any accessory muscle and any abnormality. Okay?
Okay.
And your shoulder is equal bilaterally, and your ribs is sloping downwards and symmetry into space, and costal angle is 90 degree, and anterior posterior diameter is shorter than the transfer diameter, and your chest is rising and falling equally and bilaterally, and you are not using any accessory muscle for the respiration, and your respiration rate is 16, and that is normal. Okay, now I'm going to palpate the chest, and I'm use the dorsal of my hand to palpate the temperature, and for the other I'm using the tip of finger to palpate the whole entire chest. Okay? And if you feel any pain during the palpation, just let me know. Okay? First I'm going to palpate the temperature. Okay, thank you. You feel pain?
No.
You feel pain, just let me know. Okay?
Okay.
Okay, Mr. Ram, and your skin is warm to touch, and skin is smooth in texture, and there is no lumps, mass, and any bumps. Okay?
Okay.
And now I'm going to tap your chest, anterior chest, and I am started from the apices of the lungs to the bases of lungs, and I'm going to side by side for comparison, and I'm using the tip of finger, okay?
Okay.
And tap to the finger. Oh, I had the resonance here, and I heard the resonance here too. I heard the resonance, that's normal. And here resonance too. Oh, I heard the dull here, but it's normal because of your heart, okay?
Okay.
And I heard the dull here, and it's normal due to heart. Here I am resonance here. Oh, here I heard the dull because of your liver, and it's normal.
Okay.
Okay, and now I'm going to listen your lungs breath sound. Okay, lung sound. I'm using the diaphragm of the stethoscope. First, I want to clean the stethoscope with the alcohol swab. I'm going to ascall the apices of the lungs to base of the lungs and different areas, okay? And I would like to request you, when I put the stethoscope on the each area of the lungs, and I would like to request you to breathe deeply through the mouth, okay? When I put this location in the chest, okay?
Okay.
If you feel any dizzy and discomfort, just let me know.
Okay.
Okay, Mr. Ram, I heard the three different sound on your lungs. I heard the bronchial sound and here on either side of the trachea and larynx, and that is normal. And I heard the bronchovesicular sound over the first and second intercostal space here, and I heard the vesicular sound over the peripheral of the lungs, and that is normal.
Yeah.
Okay.
Okay.
And I'm going to examine the posterior chest. I would like to request you to turn me back, okay?
Okay. Thank you.
Okay, Mr. Ram, you are in the upright position. That is perfect for the examination. Now I am going to inspect your posterior chest, and for the shape and presence of any abnormality, and your scapula in symmetry in the hemithorax, spinous process is on the central line, and there is the hair presence of here, and healing scar of acne is also present in your posterior chest, and thorax is a epileptic shape and ribs shape sloping downward. Okay, Mr. Ram?
Yeah. Okay.
And now I'm going to palpate your chest, and I'm doing this the expansion of the chest too. First I'm going to do the expansion of the chest, okay?
Okay.
And I'm using my hand, and when I ask you, you take the deep breath, okay?
Okay.
And I'm doing the expansion, and I'm putting the both hand on the posterior lateral aspect of the chest, and I'm pinching the skin on the medially, and T9 and T10, okay?
Okay.
Again, Mr. Ram. Okay. Okay, Mr. Ram. and I would like to request you to just lean, okay? Lean. And then I'm going to palpate the temperature by the dorsiflexion of the hand. Okay. And now I'm going to palpate the posterior chest. If you feel pain, just let me know, okay?
Okay.
You have pain?
No.
Okay. Okay, Mr. Ram. And your chest expansion is symmetry, even expansion, and there is no lag on the respiration, and there is no presence of the any lumps, bumps, and masses, and skin is smooth and warm to touch. Okay.
Okay.
And now I'm going to tap your chest like the anterior from the apices to the base of the lungs. Okay.
Okay.
Oh, I heard the resonance here. I heard the resonance here too. Okay, I'm going to avoid the scapular region because it elicits the long sound. I'm hearing the resonance sound here too. And here too. And okay, Mr. Ram.
Okay.
Oh, I heard the dull sound here because of its spleen here, and I heard the liver sound, dull sound here because of your liver here, and it's normal. Okay.
Okay.
And now I'm going to ask her listen your posterior long sound on the back, and just like the before, I would like to request you to take the deep breath while I'm putting the stethoscope on your chest, and if you feel any discomfort and dizziness, just stop and let me know. Okay.
Okay.
And I'm using the diaphragm of the stethoscope. I already cleaned this. Okay, Mr. Ram, I heard the bronchovesicular sound over between the scapula over here, and I heard the vesicular sound over the lungs area. Okay?
Okay.
Okay, Mr. Ram, I finished the posterior chest. I want to do the carotid artery. I would like to request you to move towards me. Okay?
Okay.
Okay, thank you.
You're welcome.
And now I'm going to examine the carotid artery, and for the carotid artery, first I'm going to scald by using the bell. Okay, I'm going to scald on the three location: angle of the jaw, and mid cervical area, and base of the neck. Okay.
Okay.
And when I'm putting the stethoscope on three location, I would like to request you to breathe to breathe deeply, exhale and hold for it, okay?
Okay.
And I'm going to do on the both side too. Okay, Mr. Ram, there is no brood and murmur. Now I'm going to palpate the carotid artery by using 2 fingers, and I'm going to palpate gently on each side, okay? And one at a time, okay? I'm
Okay.
going to palpate. Okay, Mr. Ram, carotid artery pulse contour is smooth and is rapid upstroke and slow down stroke, and strength is +2 and it is normal. Okay,
Okay.
and now I'm going to examine your jugular vein. For this, I need to put you on the 30 to 45 degree on the head inhalation, so that I would like to request you so that to sleep here, okay?
Okay.
Okay. Okay. To examine, I'm going to examine the each side of the neck and supraesternal notch, and to examine, to inspect the jugular vein. And for this, I'm putting you on the 30 to 45 degree by I'm maintaining the height with putting the 2 pillow, okay? And I'm using the transitionally light to visualize the JBP, okay?
Okay.
I would like to request you to turn this side. Okay, turn your head on this side. Okay, and up. Okay, okay, Mr. Ram, there is the no jugular vein distension and slightly visible the pulsation, and that is the normal. Okay,
Okay.
and now I'm moving on to your heart, and first I'm going to observe your heart for the heart area on the 5th intercostal space, mid clavicle line, for the presence of any visible apical pulse, heave or lift, okay, and present a free flickering moment, okay?
Okay.
Okay, and there is the no visible apical pulsation there, okay?
Okay.
And heave or lift, okay? I'm going to remove this one for the palpation of the cardiac, okay? And now I'm going to palpate your pericardium on the 3 area of the pericardium. I'm using the palmar accept of this 4 finger, okay?
Okay.
And first I'm going to palpate on the apex, and then left sternal border, and then base of the heart, okay?
Okay.
And there is the no thrill and vibration, okay?
Okay.
And now I'm going to auscult your heart sound. I'm going to auscult and 4 different places. I'm using the diaphragm of the stethoscope. I'm going to auscult on the Z pattern. From here, aortic valve is the right intercostal second right intercostal space, just right to the sternum, and pulmonic is second intercostal space, just left to the sternum, and tricuspid is the 5th intercostal space and left sternal border, and mitral is the 5th intercostal space, mid clavicular line, okay?
Okay.
Okay, Mr. Ram, I heard the love and dove sound, and yes, one is louder in the apical area, and yes, two in louder in the base area of the heart, and this is the normal. Okay, and your apical heart rate is regular and it is 72. Okay, and
Okay.
that is normal.
Okay.
And now I'm going to auscult. Now I'm going to auscult to rule out any presence of murmur and extra heart sound. I'm going to use the bell of the stethoscope on same location. Okay.
Okay.
Could you please turn this side slightly? Not more than. Okay.
Okay.
Okay, Mr. Ram, you can come here. There is the no murmur and extra R sound. Okay,
Okay.
and that is the normal. Okay, there is no murmur and extra R sound. And now I'm going to examine your abdomen. Okay,
Okay.
and for this I'm going to put this one here. And I'm wrapping the upper part. Okay, that's okay.
Okay.
And do you have any pain?
No.
Okay.
Okay.
Because if you have pain, I need to aware of this part. Okay.
Okay.
And I will, during the examination of the abdomen, I will like to request you to remain in the same position like you. Okay.
Okay.
And don't move the hand upward.
Okay.
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 And in the assessment of the abdomen, I am going to follow the technique of the inspection, auscultation, percussion, and palpation to prevent the false illusion of the vowel sound. Okay.
Okay.
And now I am going to inspect the abdomen. You are okay?
Okay.
Okay, and now for this I am going to put the pillow here to relax your abdomen. Okay.
Okay.
Yeah. And now I'm going to inspect the abdomen to know the contour and presence of abnormalities. Okay.
Okay.
Okay, your abdominal contour is slightly rounded, and there is the presence of here, and the collar is homogeneous, and there is no guarding. You look comfortable, and umbilicus is the midline inverted, and there is the no piercing, and is symmetry umbilicus and symmetry. There is no any protrusion. Okay.
Okay.
And I'm going to auscult the heart sound. Now I'm going to auscult the vowel sound in the clockwise motion. I am starting from the right lower quadrant, and then I'm going to all quadrant. Okay.
Okay.
First I'm going to on the right lower quadrant and the left sacral valve. Okay.
Okay.
Okay, Mr. Ram. I heard the 16 per minute vowel sound, and that is the normal. And I heard the gurgling sound, it is normal, and there is the no hyperactive and hyperactive vowel sound. Okay.
Okay.
And now I'm going to ascall the aortic arterial sound on your abdomen and to rule out the presence of the any vascular sound. Okay. I'm using the bell of the stethoscope and I'm going to ascall in the 7 different places. Okay. And first aorta and right and left renal arteries and right and left iliac arteries and femoral arteries. Okay. First I'm going to ascall the aorta. There is the no vascular sound or bruit, and there is the no peritoneal friction no rubs and venous sound. Okay, and it is good. Okay. And now I'm going to percuss the abdomen in all 4 quadrants in the clockers. Okay. I'm starting from the right lower quadrant. Okay. Oh, I heard the tympanic here, and I heard the tympanic here, and I heard tympanic here too. Oh, I heard the dull here. It is due to labor and it's normal. I heard the tympanic, and I heard the tympanic, and I heard the tympanic. Okay, I heard the tympanic. Okay, Mr. Ram, I heard the tympanic all over the abdomen except the right lower quadrant. I heard the dull sound and it is normal and there is the no hyporesonance sound. Okay. Now I'm going to palpate the abdomen. I'm going to palpate light palpation in all 4 quadrants. Okay. Do you have any pain?
No.
Okay. During the palpation, if you have any pain, just let me know. Okay. I'm using the 4 finger close together. Okay. You have pain?
No.
Okay, that's good. And I am just palpating. This is the light palpation. That's why I'm just palpating the 1 cm deep. Okay. Okay, Mr. Ram. And there is the, you are relaxed. There is the no muscle tensing and no mass, lumps and humps. Okay. And it's finished, Mr. Ram. Okay. I finish your examination of the chest and heart and the abdomen. All the findings are normal. Thank you for your cooperation and support for me this time. And in your abdomen there is the no muscle tension too. Okay. All the findings of the examination is the normal. Okay.
Thank you.
Okay, Mr. Ram, I would like to sit and I'm going to remove this one too. Okay, take this one. I'm going to wash my hands. And thank you. I'm going to replace the articles. Okay, thank you.